Yeah, Namaskar. I am Dr.Praveen Agarwal. I am Professor and Head of Department of Emergency Medicine at AIIMS. Our department has 6 faculty members from various disciplines like medicine, surgery, orthopedics, and pediatrics. We strive to provide world-class emergency care to all patients who come to the emergency with every kind of emergency and acute conditions. If we see roughly, we see about 450 to 400 patients per day in the emergency department. They have all kinds of emergency like surgical, medical, even children do come to the emergency with all kinds of emergencies. When the patient comes to the emergency, he should go to the screening area first, where the patient is screened according to the seriousness of the illness. Now, after the screening, the patient has to go to this either children emergency or the main emergency, which is surgical emergency, or the medical emergency, which is also known as new emergency. You need to wait for some time before you are further assessed or treated after screening. But I must reassure you that in case you have a life-threatening illness, you will be treated immediately without wasting any time. In addition to that, I would just like to inform you that our emergency has all kinds of latest gadgets which are required to treat any patient with any kind of emergency. We have all types of defibrillators, monitors, pacers, nebulizers, ventilators in adequate quantity. So any patient who comes to the emergency with any condition, there will be no lack of equipment to monitor the patients. The number of beds for admitting a patient are little less in our department. Because of this reason, sometimes we refuse admission to the patients who require admission in indoor care because of the condition. However, before shifting the patient to other hospital, we ensure that the patient is stable and is in a fit condition to shift to other hospitals. It is also important to mention here that we provide free treatment to all patients who come to the emergency. Till the time they are under observation, the patient is not supposed to pay any money to anyone. This includes any kind of treatment, blood transfusions, admission to any hospital bed. So it is advised that patients or the relatives should not pay anything to anybody. In case they feel that somebody is asking money for something, they should immediately inform the doctor on duty for that. In addition to these facilities, we also have a laboratory which runs 24 hours a day. It can perform all kinds of emergency tests within 2 minutes to 20 minutes. The reports will be available to the doctors within a very short period of time, so that they can plan their treatment of the patient in a very scientific way. I would just like to inform the public that in case you require blood transfusion, kindly try to arrange for some donor in the form of your relative or your friend, because blood is one thing which is not manufactured or which is created in a lab. It has to be donated by a human being only. The second thing I would like to inform the public is that they should not try to overcrowd the emergency. At present, many times we see that with single patient, there may be 2 or 3 or 4 relatives who are in the emergency department. This is going to increase the number of infections, cross-infection from one patient to other patient, from one relative to other patient, and also it hinders the functioning of the department because the nurses and the doctors cannot really function optimally in presence of so much of relatives inside the hospital. As I said, that at present we lack the number of beds in the emergency department. We lack the beds for observing the patient. We lack the beds for admitting the patients. So, our future plan is to have an emergency block separately, where we can cater to all patients in the form of an ICU. We can observe about 250 patients at any point of time in the emergency department, and then admit these patients to the emergency block with additional 250 beds there. So we'll be roughly having about 500 beds in the emergency block. Again, I would again say that this emergency block is going to be the state-of-art block. It will have all kinds of equipments. All drugs will be available free to the patient, and the patient will be managed by a team of doctors and nurses who will be well trained in managing patients with acute emergencies. Medical emergency has to be defined from the patient point of view or from the relative point of view. If you think that patient requires emergency care, whether the condition is not really very serious, he has to come to the emergency and seek the help of the doctor. Now, before coming to the emergency, he should ensure that the patient is breathing normally. There is no gurgling sound when he is breathing, or he is not unresponsive, he is not unconscious. If he is not breathing properly, then the patient has to be turned to one side so that the tongue, which generally blocks the airway of the patient, it gets out of the airway and the patient can start breathing normally. If the patient is unresponsive, again the patient has to be turned to one side so that he does not aspirate his secretion, mouth secretion into the lungs. Now many patients may have cardiac arrest when the patient is not breathing normally, when the patient is unresponsive. In such situations, it is the duty of the citizens to start cardiopulmonary resuscitation, which is known as basic life support. In this, the main thing is that he should compress the chest, the middle of the chest, very hard and very fast at a rate of about 100 per minute, which is known as only hands-only CPR. So he need not perform the mouth-to-mouth breathing in most of the patients. He can just perform the chest compressions and transfer the patient to a hospital for further management. In case of any ingestion of acute any drugs, say overdose of any drug or any snake bite, the person should not get panicky. There is no need to induce vomiting at home. There is no need to apply a tourniquet in case of snake bite. The patient should be directly taken to the emergency department for further opinion and further treatment. You must have read the newspapers. The accidents are very common in Delhi particularly because there is so much of traffic on the roads. Now suppose somebody meets an accident, the first thing, if he is conscious, is to get out of the roadside, out of the middle of the road. If the layperson around the person accident, the patient should be taken to the side of the road. The only important thing is to stabilize the neck of the patient. The neck of the patient and the head should be stabilized so that there is no movement in the neck of the patient, because this can create injury to the cervical spine or the neck spine, which may be fatal to the patient. Second thing after that is that patient should be taken to a hospital, nearby hospital, which can cater to trauma patients. Now if the patient is in the vicinity of the AIIMS, he can be taken directly to the trauma center of AIIMS, which is about 1 kilometer away from the AIIMS hospital. But I must assure you that in case the patient ends up in the AIIMS emergency, he'll be taken care of there also. All the initial care will be given to the patient in the emergency department of AIIMS, and only after stabilization he'll be shifted to trauma.